The sensory system. Eye diseases and disorders. Blindness. The term blindness may cover a broad spectrum of visual disability, such as the inability to see because of injury, disease, or a congenital condition. The parameters for legal blindness are visual field is 20 degrees or narrower, and or visual acuity is 20 to 200 or less in both eyes even after correction. Many of the conditions described below lead to visual disability, low vision, and legal blindness. Cataract. A cataract is a clouding of the normally clear lens of your eye. For people who have cataracts, it's like seeing through cloudy lenses or windows. The lens of the eye loses its flexibility due to the aging process, leading in some cases to senile cataracts. Infants sometimes are born with congenital cataracts. Treatments usually involves surgery to remove the clouding of the lens. Conjunctivitis. This is a condition involving inflammation of the conjunctiva. Its common causes are due to allergens, chemicals, foreign objects, as well as bacterial and viral pathogens. The cause of conjunctivitis determines if it is transmissible from one individual to another. Pink eye, caused by the adenovirus, for example, is highly contagious compared to pollen, which is not. Management involves treating the underlying cause of the conjunctivitis. Diabetic retinopathy. This is a disease of the retina caused by diabetes mellitus. The retinal veins dilate, leading to swelling as fluid leaks from blood vessels into the retina. It is estimated that 20% of newly diagnosed diabetics suffer from diabetic retinopathy. Glaucoma. This disease is part of a group of eye diseases which lead to progressive degeneration of the optic nerve. This, in turn, can lead to loss of nerve tissue that results in gradual, irreversible vision loss and potential blindness if not detected and treated early. The most common form of glaucoma is primary open-angle glaucoma. This form is associated with elevated pressure caused by a backup of fluid in the eye. Macular degeneration or age-related macular degeneration, AMD. Progressive damage of a portion of the retina known as the macula. Severe central vision is lost with peripheral vision retained. This is the leading cause of blindness in people over the age of 55. Nystagmus. This is condition whereby involuntary repetitive eye movements that make it possible to fixate on a single object. The condition is often referred to as dancing eyes. Retinal detachment. According to the eye physicians and surgeons of Ontario, this condition occurs when the retina gets pulled away or separated from its normal position. Flashing lights, floaters, and what appears to be a gray curtain are all symptoms of a retinal tear, which can lead to a retinal detachment. An ophthalmologist is a retinal specialist who can repair the retinal detachment. If left untreated, a retinal detachment could lead to blindness. Strabismus. This is a condition where the affected eye rotates due to mismatched eye coordination. Each eye is focused differently as described below. Estropia. The convergence of one or both eyes medially. Extropia, the deviation of one eye laterally. Hypertropia, the deviation of one eye superiorly. Hypotropia, the deviation of one eye inferiorly. If not managed, the brain may reject input from one eye, resulting in vision loss of the respective eye, or amblyopia. Amblyopia is a condition also known as lazy eye, which is caused when there is an imbalance of stimuli from the brain to the eyes. The one eye receives more than the other. It usually occurs in childhood and requires early intervention to rectify this condition. Specialties and procedures related to the sensory systems. Several medical specialties support the sensory systems. An optometrist is an eye specialist that examines and evaluates for ocular pathology, and an optometrist prescribes corrective lenses. An ophthalmologist evaluates and manages eye pathology as well as performs surgery. An otorhinolaryngologist, or ENT, is a physician that specializes in ear, nose, and throat treatments and conditions. An audiologist evaluates and manages individuals with hearing loss. An acoustic neuroma is a benign tumor in the internal auditory canal. Sensory system vocabulary. Blepharitis is an inflammation of eyelids. Epistaxis is a nosebleed. Glossopharyngeal is pertaining to tongue and throat. Hyperopia is farsightedness. Near objects look blurred, but distant objects are more clearly visible. Kinesthesia, body movements. Mechanoreceptors, a sensory neuron that responds to mechanical pressure. Myopia, nearsightedness. Near objects are clear and seen, but far objects are not. Nociceptors, sensory neurons that respond to pain. Ophthalmia, neonatorium, conjunctivitis in newborns, severe conjunctivitis. Pharyngitis, inflammation of the pharynx. Pharyngotonsillitis, inflammation of the pharynx and tonsils. Proprioception, body movement. Rhinitis, inflammation of the nasal cavity which can lead to rhinorrhea. Rhinorrhea, a runny nose. Sinusitis, inflammation of the sinuses. Stye, acute infection of eyelash hair follicle. Thermoreceptors, specialized neurons that respond to changes in temperature. Tonsillitis, inflammation of the tonsils. Tympanic membrane, eardrum. Visceral, pertaining to internal organs. Visual acuity, a sharpness of vision. Blindness. The term blindness may cover a broad spectrum of visual disability, such as the inability to see because of injury, disease, or congenital condition. The parameters for legal blindness are visual field is 20 degrees or narrower, and visual acuity is 20/200 or less in both eyes, even after correction. Many of the conditions described below lead to visual disability, low vision, and legal blindness. Diabetic retinopathy. This is a disease of the retina caused by diabetes mellitus. The retinal veins dilate, leading to swelling as fluid leaks from blood vessels into the retina.